Iron deficiency anemia is a common type of anemia, a condition in which blood lacks adequate healthy red blood cells. Red blood cells carry oxygen to the body's tissues. As the name implies, iron deficiency anemia is due to insufficient iron. Without enough iron, your body can't produce enough of a substance in red blood cells that enables them to carry oxygen, hemoglobin. As a result, iron deficiency anemia may leave you tired and short of breath. You can usually correct iron deficiency anemia with iron supplementation. Sometimes additional tests or treatments for iron deficiency anemia are necessary, especially if your doctor suspects that you're bleeding internally. Symptoms. Iron deficiency anemia symptoms may include extreme fatigue, pale skin, weakness, shortness of breath, chest pain, frequent infections, headache, dizziness or lightheadedness, cold hands and feet, inflammation or soreness of your tongue, brittle nails, fast heartbeat, unusual cravings for non-nutritive substances, such as ice, dirt or starch, poor appetite, especially in infants and children with iron deficiency anemia, an uncomfortable tingling or crawling feeling in your legs, restless legs syndrome. Causes of iron deficiency anemia include blood loss. Blood contains iron within red blood cells. So if you lose blood, you lose some iron. Women with heavy periods are at risk of iron deficiency anemia because they lose blood during menstruation. Slow, chronic blood loss within the body, such as from a peptic ulcer, a hiatal hernia, a colon polyp or colorectal cancer, can cause iron deficiency anemia. Gastrointestinal bleeding can result from regular use of some over-the-counter pain relievers, especially aspirin. A lack of iron in your diet. Your body regularly gets iron from the foods you eat. If you consume too little iron, over time your body can become iron deficient. Examples of iron-rich foods include meat, eggs, leafy green vegetables and iron-fortified foods. For proper growth and development, infants and children need iron from their diet, too. An inability to absorb iron. Iron from food is absorbed into your bloodstream in your small intestine. An intestinal disorder, such as celiac disease, which affects your intestine's ability to absorb nutrients from digested food, can lead to iron deficiency anemia. If part of your small intestine has been bypassed or removed surgically, that may affect your ability to absorb iron and other nutrients. Pregnancy. Without iron supplementation, iron deficiency anemia occurs in many pregnant women because their iron stores need to serve their own increased blood volume as well as be a source of hemoglobin for the growing fetus. Complications. Heart problems. Iron deficiency anemia may lead to a rapid or irregular heartbeat. Your heart must pump more blood to compensate for the lack of oxygen carried in your blood when you're anemic. This can lead to an enlarged heart or heart failure. Problems during pregnancy. In pregnant women, severe iron deficiency anemia has been linked to premature births and low birth weight babies. Growth problems. In infants and children, severe iron deficiency can lead to anemia as well as delayed growth and development. Tests and diagnosis. To diagnose iron deficiency anemia, your doctor may run tests to look for red blood cell size and color. With iron deficiency anemia, red blood cells are smaller and paler in color than normal. Hematocrit. This is the percentage of your blood volume made up by red blood cells. Normal levels are generally between 34.9 and 44.5% for adult women and 38.8 to 50% for adult men. These values may change depending on your age. Hemoglobin. Lower than normal hemoglobin levels indicate anemia. The normal hemoglobin range is generally defined as 13.5 to 17.5 grams G of hemoglobin per deciliter DL of blood for men and 12.0 to 15.5 grams per deciliter for women. The normal ranges for children vary depending on the child's age and sex. Ferritin. This protein helps store iron in your body, and a low level of ferritin usually indicates a low level of stored iron. Additional diagnostic tests. If your blood work indicates iron deficiency anemia, your doctor may order additional tests to identify an underlying cause, such as endoscopy. Doctors often check for bleeding from a hiatal hernia, an ulcer or the stomach with the aid of endoscopy. Colonoscopy. To rule out lower intestinal sources of bleeding, your doctor may recommend a procedure called colonoscopy. A colonoscopy allows your doctor to view inside some or all of your colon and rectum to look for internal bleeding. Ultrasound. Women may also have a pelvic ultrasound to look for the cause of excess menstrual bleeding, such as uterine fibroids. Treatments and drugs. To treat iron deficiency anemia, your doctor may recommend you take iron supplements. Your doctor will also treat the underlying cause of your iron deficiency, if necessary. Iron supplements. Your doctor may recommend over-the-counter iron tablets to replenish the iron stores in your body. Your doctor will let you know the correct dose for you. Iron is also available in liquid form for infants and children. To improve the chances that your body will absorb the iron in the tablets, you may be instructed to take iron tablets on an empty stomach. If possible, take your iron tablets when your stomach is empty. Don't take iron with antacids. Take iron tablets with vitamin C. Treating underlying causes of iron deficiency. If iron supplements don't increase your blood iron levels, it's likely the anemia is due to a source of bleeding or an iron absorption problem that your doctor will need to investigate and treat. Depending on the cause, iron deficiency anemia treatment may involve medications, such as oral contraceptives to lighten heavy menstrual flow, antibiotics and other medications to treat peptic ulcers. If iron deficiency anemia is severe, you may need iron given intravenously or you may need blood transfusions to help replace iron and hemoglobin quickly. Lifestyle and home remedies. You can reduce your risk of iron deficiency anemia by choosing iron-rich foods. Choose iron-rich foods. Foods rich in iron include red meat, pork, poultry, seafood, beans, dark green leafy vegetables, such as spinach, dried fruit, such as raisins and apricots, iron-fortified cereals, breads and pastas, peas. Your body absorbs more iron from meat than it does from other sources. If you choose to not eat meat, you may need to increase your intake of iron-rich, plant-based foods to absorb the same amount of iron as someone who eats meat. Choose foods containing vitamin C to enhance iron absorption. You can enhance your body's absorption of iron by drinking citrus juice or eating other foods rich in vitamin C at the same time that you eat high iron foods. Vitamin C in citrus juices, like orange juice, helps your body to better absorb dietary iron. Vitamin C is also found in broccoli, grapefruit, kiwi, leafy greens, melons, oranges, peppers, strawberries, tangerines, tomatoes,